three reporters. We've got Lucas Meyer, Amy, and I pitched and tried to get Okay, good to go? Yeah. Good afternoon, everybody. Welcome to the City of Toronto's COVID-19 media briefing for Wednesday, August the 12th, 2020. Joining us today is Mayor John Tory. On the line from Toronto Public Health is the Associate Medical Officer of Health, Dr. Vinita Dubey. Mayor Tory?
Well, Brad, thank you, and good afternoon. Today, Toronto Public Health is reporting the total number of cases of COVID-19 in our city is now 15,548, an increase of 8 cases. So our hard work is continuing to pay off, and when I say our, I'm really directing that to the people of the City of Toronto, but also complemented by a lot of hard work by a lot of public servants. I want to just say thank you to the majority of Toronto residents, the vast majority of Toronto residents who continue to follow the public health advice to keep themselves and their families safe and healthy. Today, we heard other good news as well, and that was good news from the governments of Ontario and the Government of Canada. The news was announced actually by the Government of Ontario, but it represents a joint funding commitment to help municipalities made by the governments of Canada and Ontario. I spoke this afternoon myself with the Minister of Transportation, Caroline Mulroney, about some help for transit, which I will talk about coming up now. It is good news that we received for our transit system, and good news for the frontline city services that we know we must continue to provide as we have done throughout the course of this pandemic, including in some cases with increased investment on our part to look after most vulnerable populations. So we'll be reviewing the allocations just announced today from the Safe Restart Agreement, which is the agreement between the federal and provincial governments. But the preliminary report from city staff, and just taking a look at it within the context of what we had asked for, is that it will help our transit system and go a very long way towards helping our operating budget for city services, which was heading towards a very significant deficit, as you know. The government has made it clear that this funding is coming in 2 phases, it being phase 1 that was announced today. So we will be working with them, as I discussed with the Minister of Transportation, to outline the costs of responding to COVID-19, the impact of COVID-19 on things like transit revenues as we go forward to do what will largely be a mathematical exercise with them in the phase 2 funding allocation to come this fall. The fact that transit funding, the transit funding we will receive, is based on ridership is crucial for our city and the TTC as the operators of by far the biggest transit system in Ontario and in the country. The TTC will, in the first phase of transit funding, receive $400 million. In fact, the minister told me precisely it's $404 million in the first phase of the funding. That represents a very strong down payment for our transit system, which we know must keep going so that we can have as safe a restart and as effective a restart of the city and its economy as possible. We've been fighting for this funding to protect our TTC and our city services in the wake of this pandemic. I was just saying on the way here that what we had going just a few weeks ago is what amounted to a 4-alarm fire with respect to the impact that COVID-19 has had on our finances, and we called the people we needed to call to get some help in fighting that fire, namely the Government of Ontario and the Government of Canada, and they have responded to many discussions that we had over time, and we worked well with other cities, both in Ontario and across the country. The city has not just stood back or sat back and waited for these other governments to come to help. We went to work to help ourselves and found, through the hard work of our public service, $500 million in savings and efficiencies. And in turn, this, I think, has made it easier for the governments of Canada and Ontario to respond with their financial support, because we knew that we had our own job to do with respect to finding savings and efficiencies, which we will continue to do. We're basically doing that on a continuous basis since the beginning of the pandemic. This cooperation to make sure that Toronto and all municipalities continue to respond to COVID-19 is exactly what people expect their governments to do. And I think it is a hallmark of the success that we have enjoyed, relatively speaking, in this country in dealing with this terrible pandemic, which is that we have worked together. We've worked together. There's been no partisanship come in the way. There has been nothing but cooperation, sharing of information. I've tried to help work with these other two levels of government, these orders of government, when I could to facilitate a resolution, and I'm just happy that we have come to one, albeit that there is a second tranche of funding yet to come, but that's going to be based on what are sensible negotiating or calculation parameters that we're going to engage in together to make sure that the taxpayers' money is wisely stewarded. I want to express my personal thanks to Prime Minister Trudeau and Deputy Prime Minister Chrystia Freeland, and to Premier Ford, Finance Minister Rod Phillips, and Transportation Minister Caroline Mulroney. All of those people we have been directly involved with in all of these discussions over several months, and I'm glad that we're seeing it come to fruition now, knowing that we don't have all of the exact numbers, but we know that what is happening today and what is going to happen in the coming weeks is going to go a long way to resolving the issues that we have been bringing to public attention and to their attention for several weeks now. So now that we're well into stage 3, the City of Toronto is continuing to safely and gradually reopen services and amenities for everybody to enjoy during the balance of the summer and beyond. I'm proud to announce today that the City is resuming its Urban Forestry Community Stewardship Program. And this is an important volunteer tree planting and forest stewardship program that supports the health of Toronto's green spaces and ravines and urban forests. And sometimes these things don't sound that important, but in the context of a city of ravines and trees, we rely on these kinds of programs and the activism and engagement of our citizens to keep these areas healthy, to work in partnership with the government. The program will resume in a modified format to meet provincial restrictions and public health recommendations following the suspension of the program in March because of the COVID-19 response. The volunteers who make up such an important part of this program have been contacted, and the first session involving them and their activities to look after our urban forests and ravines will take place on Monday. The program invites volunteers aged 14 and up, or younger if accompanied by a legal guardian, to help maintain the natural integrity of our green spaces by planting trees and shrubs and wildflowers and more, while developing leadership and interpersonal skills. And people that are involved in this program themselves meet other people and earn volunteer hours. The volunteers will work in teams of up to 10, guided by an experienced volunteer team leader, and they'll be doing it at sites right across the city. The need for this work, of course, has not diminished over the time of the pandemic, and our community stewardship volunteers will continue to play an important role in helping us to restore nature in Toronto and grow our urban forest for both people and for the protection of wildlife. Additionally, I should report to you that a number of city recreational programs and services at community centres will also resume in a phased way. Starting Monday, we will be reopening 36 of the city's fitness centres. The city's change rooms and showers at recreational facilities will also reopen on Monday. To help people respect the public health rules for these facilities and to help us manage demand, the city is introducing a new online reservation option for its indoor drop-in lane swim program, as well as for its fitness centres. This system will be up and running starting tomorrow. The new online reservation option enables people to conveniently book, for example, an indoor lane at one of our 29 indoor pool locations, or to book a workout time at select weight rooms and fitness centres. And this respects the fact that we're going to have limitations on how many people can be in the pools and in the fitness facilities at a time, and this will help to avoid people showing up and finding that they can't get in, whereas they will have made an appointment in most cases. Now, I should point out that while we're trying to do these things both in the interests of public health and modernizing the way people interact with city facilities, that it still will be possible for people to walk in without a reservation, but it will be subject to the availability of space. The reservations for indoor lane, swim and fitness centres are the best way in which we can plan ahead and make sure that there is space. And people can find the online reservation tool at toronto.ca/swim and toronto.ca/fitness. So that's toronto.ca/swim and toronto.ca/fitness, where you can go to make these online reservations for these facilities. We are working hard to make sure the reopening of our facilities in Stage 3 is done as safely as possible, but we do require the cooperation of the public, and we require it not just in the context of trying to use these new tools that we've made available, which should be more convenient to use these spaces, but also with respect to, for example, the very important matter of wearing a face covering. We are going to require, and we do require, the wearing of a face covering in indoor public spaces, which includes change rooms, washrooms, and other inside spaces in these city facilities we're talking about today. People are permitted to take their masks off during exercise, but you are required to put it back on when finished. And, of course, the number of people allowed in a fitness facility at any one point in time is going to be restricted to provide space for physical distancing. We thank people in advance for their patience with these things, these limitations that have been put in place, but they are put in place solely on the advice of our health experts and solely to stop the spread of COVID-19, and see that the successful kinds of numbers, 8 cases today that I've reported upon, are maintained and even diminished further as we continue to open the city up. In early September, people can also expect the following services to resume: drop-in fitness, aquatic fitness and sport programs, walking tracks at community centres, and seniors drop-in programming. And these are all things I've seen from my own visits to these community centres. They're very popular, many of them especially with our senior population. I know these are valued services, and we are working within the context of public safety and public health to bring them back online as quickly as possible. I want to, on that note, say another word of thanks, because the work that has been done by our Parks, Forestry and Recreation staff throughout the pandemic, both monitoring some of the things where we've had some challenges like the beaches, but also to reopen these facilities and make sure they're safe and clean for people and healthy, has been epic. And I just want to say again thank you to those people and all the work they've done on things like reforming our city day camps, splash pads, pools, and doing all of this in the midst of a pandemic. We have said many times here, I have said many times here, there is no vacation from COVID-19. It's not taking any summer holidays. But we've also worked hard at the same time, carefully following public health advice to make sure that summer and so many of the good things that Toronto has to offer in the summer are enjoyed to the maximum extent possible, and that we didn't have a totally lost summer, especially for young people who really look forward to and need these kinds of structured activities in their day-to-day lives. And so I hope that those efforts have been appreciated by you, and that we will continue to open things up as quickly as we possibly can within the context always of keeping the city healthy. So I'm happy now to turn it over to Lavin to monitor the questions.
I'll take care of that, Mr. Mayor. Today,
Brad, I was used to the days when she was monitoring that, but you go ahead.
thank you, sir.
Glad to have you here.
Thank you. So in addition to Dr. Dubé, who is available for any questions regarding public health, we also have staff from Shelter Support and Housing, Municipal Licensing and Standards, Senior Services and Long-Term Care, and Parks, Forestry and Recreation. First question is to Lucas Meyer from News Talk 1010. Lucas, go ahead, please.
Thanks a lot, Brad. Mr. Mayor, I just want to begin actually on an economic question. In terms of the fall, do you have an idea, in speaking with different companies, different executives, et cetera, about what workforce we should be expecting, come September, October, assuming the school year begins on time, of course? I'm just curious if you have a sense of what, the core and just the labor force is going to look like. Are we expecting, along with that, perhaps, a resurgence in traffic? I'm just trying to get an idea of economically, along with the school restart, how you think it's going to look in the fall from an economic activity, just labor force perspective.
I've spent a good part of my day actually on this today, and I'm very concerned about it because, the challenge we had was to try and achieve a balance between not overwhelming the transit system, the downtown elevators, the threat to health that's represented by large crowds of people, while at the same time seeing the city restart itself in an effective manner. Because until you have people to some extent back to work, knowing that we've had some success with working at home for people, I think it's going to be difficult for a lot of the businesses, say, for example, downtown, that rely on people being downtown downtown, you're not going to have them able to recover properly. And so I'm having some meetings later this week and early next week to make sure that we have enough people coming back to work that it is a meaningful start at reopening that part of the city, the downtown and the office buildings and the workers as such, to help all the businesses that rely on that traffic day in and day out and have been closed in many cases for a long time, but at the same time to make sure that we don't provide too much stress on things like the transit system. And at the moment, I would say I'm worried about it, because I think that from what I gather from my conversations with the employers, not only are they phasing for a variety of reasons, including trying to fix some of their workplaces to provide for physical distancing, not only are they doing that kind of thing, which is consistent with our wishes to have a phased return to work, but in many cases they are, experiencing some degree of discussion, shall we say, with their employees about their own feelings about coming back to work, just in terms of some of the anxieties people are feeling when it relates to things like the school return system. So that's a very honest answer to a problem that has no simple answer, that everybody or nobody's coming back. It's one of those things where every employer seems to have their own policies, and some have not yet formulated a policy. But I'm watching it very carefully, because there is that balance to be achieved, and not going too far either way, not having everybody come back to work the day after Labor Day, but also at the same time not having nobody come back to work, because there's a lot of businesses that we have to pay attention to without sacrificing public health in order to make sure that the downtown of the city and the city as a whole remain economically healthy as well.
So, Mayor, if I could follow up on that, so what is the city's, what will the city's responsibility in that, in terms of, communication, in terms of public relations, and trying to, establish that balance? And perhaps, Mary, if you could even give an example of an area where you just mentioned you don't want to go too far one way or the other, but could you maybe give an example of a potential, bad scenario come the fall?
Well, I don't traffic in bad news scenarios, I think, as you know, and it's not just because I'm an optimist, which I am, but it's also just because I don't think it's that constructive. But I'll say to you, for example, an area of prime concern to me among many, many that I'm worried about and that I spend my days trying to help with is the underground path system, where I don't know the precise number of stores, but it's in the hundreds. And those hundreds of stores represent thousands of jobs in total. And it's obvious that if there are no people working in all the downtown towers that are connected by that maze of paths, that a lot of those businesses either will not be able to open at all, or will not be able to remain in business at all because they don't have any customers. And so, again, that can't be the primary consideration. The primary consideration has to be public health. But at the same time, public health probably dictates that what we can do, and we've had many discussions, and they've been very constructive with the landlords and with the businesses, to phase the way people come back to work. And we wanted that for the sake of the transit system, as well as public health, as well as the economy. And so there's an example, though, of something that is obviously very dependent on people coming back to work to some extent. It doesn't have to be all at once. And so I'm just saying there's a lot at stake in all of these decisions that are made, I guess, in partnership between us and business, although in the end it's their decisions. We've had very constructive, very good discussions with them, which I'm continuing with this week and next, in order to try and establish what is the best thing for them and the best thing for us, meaning the city as a whole, in terms of achieving our health objectives, but also making sure that we get the economy back on its feet as soon as we can.
Okay, thank you. We'll go next to Matt Bingley from Global News. Matt, go ahead, please.
Hi, good afternoon. Mayor, you said that the province has told you that first phase of funding for transit will be $404 million. I'm just wondering if you have been told how much the city will also get for the operating costs and vulnerable people fund that also is included in this first phase, and if you could just give us an update on how that money given will offset the net $1.3 billion deficit.
I think you can start to do some rough calculations based on, in terms of the municipal share of the funding as distinct from transit, which is based on ridership. They've said some of the municipal money is going to be based on households, the number of households. So you can look at the number of households in the city and determine that as a share of the households in the entire province, and see in this first phase again that we're likely to get a very significant sum of money. But we're going to leave the city officials to talk to the provincial people in the wake of the announcement today to make sure that we don't give you any numbers that are misleading misleading. I can give you the transit number because the Minister of Transportation gave me the exact number at 404 million for the first tranche of the transit money in our conversation today, as well as telling me that I'd be receiving a letter that will actually confirm that. And I will just say that I think this is a very fair and prudent way to do this in 2 tranches, and so that we can sit and actually go over the numbers in detail together in the period of the next few weeks. They're not planning to have this go on for months. It's going to be in the next few weeks. We're going to sit together and go over the numbers. And I will say to you this. If I look at where we were 6 or 8 weeks ago, when we had no assurance from anybody that any money was coming and that there hadn't been an agreement reached between the 2 orders of government, federal and provincial, and I look at what I know transpired because I was part of it, I really believe that we are headed here, to answer the second part of your question, we are headed in a very positive way towards having a very big chunk of our problem looked after. I don't want to say how big the chunk is or even get to the stage of saying all of it, although I don't think that's impossible, just because we don't have the precise calculations of both today's phase and the second phase, but I think it's a very significant step forward. And again, I express my gratitude to the other 2 orders of government for the fact they've stepped forward in this manner.
Thank you. And just my second question had to do with the TTC and service, the potential service cuts. You know, before this all arose, or at least the funding was announced, you said that there were significant threats of service cuts and disruptions. I'm wondering, with the 404 million that has now been committed, is that enough to guarantee that there will not be any service cuts or disruptions?
Well, I think, as you know, we're presently operating under a modified service plan that took account of the dramatically reduced ridership, and we've been adding buses as required as ridership has come back up on the buses in particular, not so fast as yet on the subways or streetcars. We have said we would take another look at the service levels we're providing in a positive way once the ridership reached 50% of normal. It is presently at about 35% on a blended basis, slightly higher on buses, slightly lower on the subways and streetcars. And so we are not looking at service reductions. We are looking at service enhancements when the ridership rises up to about that 50% level. This money will help us to really just recover revenue that we lost. It in fact is going to replace the revenue we lost because of people not riding on the subways or streetcars during the pandemic to a large extent. And so it will help us to look after problems that already existed before, let alone it's not going to, we're not anticipating other problems at this moment. We're hoping things will start to get better.
Okay, thank you. Final question is to Dave Ryder from the Toronto Star. Go ahead, Dave.
Hi, Mayor Tory. I'm going to try to nail you down a little bit more on what Matt was asking, which is, I guess people want to know.
Dave, you're just fading out a little bit there.
We'll turn it up here,
Okay,
Mr. Mayor.
I'll try. Yeah, I'll just say I'm just trying to follow on Matt's question, and since there was so much attention given to the huge financial hole that Toronto has, I'm just really trying to understand if your understanding is that the problem is solved. I know you said it's a big chunk, but like, are you getting assurances from the province that Toronto will not face a hole? Because we know from budget time, even a $5 or $10 million hole can result in a reduction of services.
I will tell you right now that we're having the city manager, of course, work on a report that will be presented to council, and that'll be a more reliable calculation based on a couple of more weeks of discussion with the province and analysis of the numbers that came out today, remembering that only phase 1 of those numbers came out today. But I think if you do the mathematical calculations based on transit ridership and the available funds for transit in the joint agreement between Canada and Ontario, the numbers will go a very long way to resolving the issues we have on that front. On the other fronts, I believe the same is true as well. And I will just say to you that I think it'll go far enough that if there is any shortfall, which I don't, I'm not anticipating or hoping or planning or have not calculated there will be one, but that if there's anything, we're going to redouble our efforts, which we're already doing, to find other savings and efficiencies so that we do not have to contemplate service cuts. But I don't want to just say that there's been a conclusion reached on any of this simply because we don't have all of the numbers as yet. I don't even have the letter that's coming, for example, from the transportation minister that's confirming the 404 million, although I have her telling me it on the telephone. So, I'm optimistic about this. I'm grateful that we've arrived where we were compared to the 4-alarm fire that was burning a few weeks ago, but I just want to make sure that we, declare that this year's problems are looked after when they're actually looked after, but I'm very optimistic we can make ends meet without without the kinds of service cuts we'd had to contemplate before we had the confirmation of the money from the two governments. Plus our savings.
Thank you. And my follow-up question is about funding and rule changes to prevent the overdose crisis that we've seen. Joe Cressy yesterday said the cooperation we've seen between governments on COVID has been absent when it comes to trying to prevent a record number of deaths. And he had some stern words from the province, said that the Toronto's medical officer of health had a bunch of recommendations, and so far they've all been refused. Can you address that?
We're having trouble getting the attention, especially of the provincial government, and I'm going to be having a conversation with Minister Tibolo, who, as you know, has responsibility in this area of addictions and mental health. He is very committed to trying to do more in this area. But we need a much bigger effort on the part of the other two governments working with us. It's a three-way partnership to address what is a crisis of unbelievable proportions. There is no other area other than the highly unusual once-in-a-century episode of a pandemic that is taking as many lives in our city right now as is happening from things related to drug addiction and drug overdoses. It's stunning. It is tragic. It is unacceptable. It is hugely disconcerting. It is something that Canada as a whole should not accept, Ontario should not accept, Toronto should not and must not accept, is this kind of preventable loss of life. And so I have been in discussions with the Minister of Health nationally. I have been in discussions and will continue those discussions with Mr. Tibolo. But I will just say that collectively, we have to do much better than this. This loss of life of dozens and dozens of people in very short periods of time, and it goes on to total hundreds of people over the course of a year. And it kind of happens, not because we try to keep it that way, but it kind of happens, out of sight. And that's part of the problem sometimes, is these things happen out of sight, but they are still losses of lives, of Torontonians. And we've done some things that are preventing loss of life and are very effective in that regard, but not enough. And so you're darn right that I'm not satisfied with the collective effort that we've been able to make, and we need more support. I've said before, and I've said it directly to the Prime Minister of Canada and to the ministers provincially. I haven't had a conversation with the Premier about it, but I have said this. There was an agreement entered into by those two governments, Ontario and Canada, and I hate to say this on a day when I'm actually trying to laud them for agreements they've entered into that are benefiting us and solving some problems. They already signed an agreement in the billions of dollars a couple of years ago meant to address mental health and addiction issues. And what I said to the Prime Minister when he was in my office not that long ago is that I just haven't seen the investment coming from that money in ways that, with my own eyes and with my own ears, listening to our experts and people who are supporting those who are afflicted by these addiction issues, are visible. Increased treatment programs, increased support for some of the harm reduction initiatives we're undertaking. We need that help. We need it now. People are dying. We're saving lots of lives, but we're still losing far too many. So that is something I'm very engaged in, and it's under very active discussion, because how can it not be?
Thank you, Mayor Tory, and thank you, everybody, for joining us. That concludes today's briefing. Thank you.